You've probably tried 3 or 4 pain relief creams for your sciatica, and most of them did absolutely nothing. That's not your fault. That's because most of what's being sold in pharmacies right now is not designed for nerve pain. Today, I'm going to show you exactly what to look for on the label, what ingredients actually penetrate deep enough to matter, and the creams I personally recommend to my patients with sciatica. Stay with me, because this changes how you shop forever. Sciatica is one of the most miserable, most misunderstood types of pain there is. And the frustrating part? Most people spend months trying random creams, patches, and gels without anyone ever explaining to them why some work and most don't. I'm Dr. Michael Kent, and today I'm going to fix that. I'm breaking down the best OTC pain relief creams for sciatica in 2025 by active ingredient, by strength, by what the research actually says, so you can make a smart, informed decision and finally feel some real relief. Before we get into the specific products, I need to make sure you understand something fundamental about sciatica, because if you don't understand what's happening in your body, you can't make a good decision about how to treat it. Sciatica is not a muscle condition, it is a nerve condition. The sciatic nerve is the longest, widest nerve in the human body. It runs from your lower spine through your buttocks, down the back of each leg, all the way to your feet. When that nerve gets compressed, and whether by a herniated disc, a bone spur, a tight piriformis muscle, or spinal stenosis, it sends pain, burning, tingling, and numbness along its entire pathway. That shooting, electric, sometimes unbearable sensation you feel going down your leg, that is a compressed nerve talking to you. And this matters enormously when we talk about creams, because most standard pain relief creams are designed for muscle and joint pain, not nerve pain. They don't work the same way, and many of them simply won't penetrate deeply enough to reach where your pain is actually coming from. So when I'm evaluating an OTC cream for sciatica, I'm looking at 3 things. First, what are the active ingredients, and are any of them clinically relevant for nerve pain? Second, what is the delivery mechanism, and how deeply does the product actually penetrate the skin barrier? And third, what does the actual evidence say, not just the marketing language on the front of the box? With that framework in mind, let me walk you through the ingredient categories that genuinely matter. If you're new here and you want honest doctor-led health information every single week, go ahead and hit that subscribe button right now and turn on notifications so you never miss a video. It takes 2 seconds and it means more than you know. Now let's keep going. And before we go any further, drop a comment below right now and tell me your age and your city. I read every single comment, and it genuinely helps me understand who is watching and what content will help you most. Do that now, and then stay with me, because we're just getting started. The first ingredient category I want to talk about is menthol. Now, menthol gets a bad reputation in serious medical circles because it's often associated with those light, tingly creams that feel refreshing but don't really do much. And to be fair, low-concentration menthol products, anything under 2 or 3%, really are mostly cosmetic. But here is what changes the story entirely. High-concentration menthol at 8% and above has been shown in peer-reviewed research to activate specific cold receptors in the skin called TRPM8 receptors, which actively compete with pain signals being transmitted along the nerve pathway. In plain language, strong menthol doesn't just make you feel cool, it actually interrupts the nerve signal that is carrying your pain. For sciatica patients, a product with 8 to 10% menthol applied directly along the nerve pathway, that meaning the lower back, the buttock, and the back of the thigh, can provide meaningful, real relief. Not a cure, not a permanent fix, but genuine functional relief while you're managing the underlying cause. The second ingredient I want to talk about is capsaicin, and this one surprises a lot of my patients. Capsaicin is the active compound in chili peppers. And yes, the first time you apply it, it burns quite a lot. But here is the mechanism that makes it genuinely valuable for nerve pain. Capsaicin works by depleting a substance called substance P in the sensory nerve endings. Substance P is the chemical messenger that carries pain signals. When capsaicin depletes it repeatedly over days and weeks of consistent application, those nerve endings become significantly less sensitive to pain. This is not a temporary masking effect. It is an actual desensitization of the nerve pathway. Clinical studies on capsaicin for neuropathic pain consistently show meaningful and lasting pain reduction with regular use. The key word is regular. You have to apply it 3 to 4 times a day for several weeks before you see the full benefit. Most people quit after 3 days because of the initial burn and never get to the part where it actually works. don't be most people. Third on my list is Diclofenac, and this is the heavy hitter. Diclofenac is a non-steroidal anti-inflammatory drug, an NSAID, and unlike oral NSAIDs like ibuprofen, which travel through your entire system, topical diclofenac is designed to penetrate locally and deliver anti-inflammatory effects directly to the tissue underneath. It was previously prescription only in many markets, but it is now available over the counter in 1% gel formulations. For sciatica that has an inflammatory component, which is most sciatica because nerve compression almost always triggers local inflammation around the nerve root, topical diclofenac can be genuinely effective. It won't replace oral medication in severe cases, but for mild to moderate inflammatory sciatica, it is one of the most evidence-backed topical options available right now. I want to stop here and tell you about a patient of mine named William. He gave me full permission to share his story, and I think it will make everything we've been talking about click into place. William came to see me about 14 months ago. He was 53 years old, worked in logistics management, and spent most of his day either sitting at a desk or driving between sites. He had been dealing with left-sided sciatica for almost 8 months by the time he walked into my office. The pain ran from his lower back, through his left buttock, and straight down the back of his thigh to just below his knee. Classic sciatic distribution. What struck me about William was not just the severity of his pain, but the number of things he had already tried. He had a drawer at home that he described as a graveyard of creams. Bengay, Icy Hot, Tiger Balm, 2 different CBD creams, something called a nerve repair balm he'd bought online for $40. None of them had given him more than an hour of partial relief. He told me, and I remember this exactly, he said, "I started to think the pain was just permanent. Like this was just my life now and I had to accept it." That broke my heart a little because I hear that from so many patients. People who have been suffering and trying and failing for so long that they've started to believe suffering is simply their fate. Here is what we changed for William. First, we got a proper MRI done, which confirmed a mild L4-L5 disc herniation with moderate nerve root compression. Not severe enough for surgical intervention, but very real and very treatable conservatively. I put him on a combination protocol, a course of physical therapy targeting the lumbar stabilizers and piriformis muscle, a short course of oral anti-inflammatories to address the acute flare, and for topical management, I recommended a high-concentration menthol gel for immediate symptom relief during flares, a capsaicin 0.1% cream for consistent daily application along the nerve pathway, and diclofenac gel for use on the lower back after his physical therapy sessions. 8 weeks later, William came back for a follow-up, and he was a completely different person. He wasn't pain-free. Sciatica rarely resolves completely in 8 weeks. But his daily pain level had dropped from a 7 out of 10 to a 2 or 3. He was sleeping through the night. He was driving without having to pull over. He had stopped dreading getting out of bed every morning. The difference was not one magic product. The difference was using the right products in the right way, as part of a comprehensive approach, and finally understanding why each one was being used instead of just grabbing whatever was on the shelf. William's story is not unique. I share it because it is the most common version of what I see. Intelligent, motivated people who have been suffering unnecessarily because nobody took the time to explain the difference between a cream that masks pain and a cream that actually interacts with the source of that pain. That is what I'm doing here today. That is what this channel is for. Now let me get specific about what I actually recommend in 2025. For high-concentration menthol, BioFreeze Professional Strength at 10% menthol is consistently the product I point patients toward first. It comes in both a roll-on and a cream formulation. It absorbs quickly, and the concentration is clinically relevant for nerve pain, not just cosmetic tingling. Apply it along the full pathway of your pain, lower back, buttock, and the back of the thigh. For Capsaicin, Zostrix Natural Pain Relief Cream at 0.1% is the most widely available and well-formulated option at the OTC level. It requires patience. I cannot stress this enough, but the mechanism is real and the results, when used consistently, are real. For Diclofenac, Voltaren Arthritis Pain Gel is now available over the counter and is my top recommendation for patients whose sciatica has a strong inflammatory component. Apply it to the lumbar region, not directly to the nerve pathway down the leg, as it works best at the site of the spinal inflammation that is compressing the nerve root. I also want to address CBD creams because I get asked about them constantly and I want to give you an honest answer. The current clinical evidence for topical CBD specifically for sciatic nerve pain is limited. We have some preclinical studies suggesting anti-inflammatory and analgesic properties, and there are certainly patients who report benefit, but we do not yet have the robust, large-scale human trial data that I would want before making a strong recommendation. That doesn't mean CBD creams are useless. It means the evidence base is not yet strong enough to place them in the same tier as menthol, capsaicin, or diclofenac. If you've tried the other options and want to explore CBD cream as an adjunct, I'm not going to tell you not to. Just don't let it replace evidence-backed options and choose a product from a company that provides third-party testing documentation for purity and actual CBD concentration. I also want to spend a moment on what to avoid because the pain relief aisle is full of products making claims that the science does not support. Anything claiming to regenerate nerve tissue through topical application is not being honest with you. That is not how nerve regeneration works, and it cannot happen through the skin. Anything with a proprietary blend that refuses to disclose the actual concentration of each active ingredient should be treated with real skepticism. In my experience, proprietary blends are often a way to hide the fact that ingredient concentrations are too low to be clinically meaningful. And anything sold primarily through social media with dramatic testimonials rather than any ingredient transparency, skip it entirely. Your money and your pain deserve better than that. Now I want to be completely honest with you about something important. Topical creams for sciatica, even the best ones, are a management tool. They are not a cure. They can meaningfully reduce your daily pain, improve your function, and make other treatments more effective by controlling the symptom load. But sciatica has an underlying structural or biomechanical cause, and that cause needs to be addressed for long-term resolution. Physical therapy is the most evidence-backed conservative intervention we have for lumbar sciatica. A skilled physical therapist can identify the specific muscle imbalances and movement patterns contributing to nerve compression and teach you how to correct them. In many cases, people achieve complete resolution of sciatica through physical therapy alone. Add in the right topical management alongside that, and you significantly accelerate your recovery. If physical therapy has not been part of your sciatica management plan, that is the conversation I'd encourage you to have with your healthcare provider today. And if your sciatica is severe, if you have significant weakness in your leg, if you've lost control of your bladder or bowel, or if your pain is getting progressively worse rather than stable or improving, please do not manage this with creams alone. Those are signs that need urgent medical evaluation. That level of nerve involvement requires imaging and a specialist, and I want to be very clear about that line. For everyone else, for the millions of people dealing with that aching, burning, shooting sciatic nerve pain that disrupts sleep and limits daily life, the right topical products used intelligently as part of a broader plan really do make a meaningful difference. The difference between a cream that works and one that doesn't is almost never luck. It's knowledge. It's knowing what ingredient you need, why you need it, and how to apply it correctly. That is what I want you to take away from today's video. Go back to your medicine cabinet with new eyes, read the labels, look for the concentrations, ask the right questions, and please stop settling for partial relief when real relief is within reach. If this video helped you, if it gave you something real and actionable that you didn't have before, please share it with someone who is dealing with sciatica right now. Share it with a parent, a partner, a friend who's been suffering in silence. It costs you nothing, and it could genuinely change their day. And if you haven't subscribed yet, do it right now. Hit subscribe and turn on the bell so you get every new video the moment it goes live. We cover everything from nerve pain to nutrition to hormones to heart health, all of it doctor-led, all of it in plain language, all of it free. I'll see you in the next one. And one last thing before you go. Tell me in the comments your age, your city, and how long you've been dealing with sciatica. I want to hear your story. Your comment might shape the next video I make. Subscribe, share, and I will see you very soon. The information presented in this video is intended solely for general educational and informational purposes and does not constitute medical advice, diagnosis, or treatment of any kind. Dr. Michael Kent is a licensed medical professional. However, the content shared here is not a substitute for a professional consultation, physical examination, or individualized treatment plan provided by a qualified healthcare provider. Every individual's medical situation is unique, and the products and recommendations discussed may not be appropriate for everyone. Always consult your physician or a qualified healthcare provider before beginning any new treatment, including over-the-counter topical products, especially if you have existing medical conditions, are taking prescription medications, are pregnant or breastfeeding, or have experienced recent changes in your symptoms. The patient story shared in this video is presented with full permission and is included for illustrative educational purposes only. Individual outcomes vary significantly and are not guaranteed. If you are experiencing severe or worsening neurological symptoms, including weakness, loss of sensation, or loss of bladder or bowel control, seek emergency medical evaluation immediately. By watching this content, you acknowledge that Dr. Michael Kent and this channel bear no liability for any health decisions made based on the information provided,